Afternoon, my name's Dr. Paul Lancaster. I'm a consultant anaesthetist here at the Face and Eye Clinic, and I'll be looking after you for your procedure today.
Thank you. I'm told that my anaesthetic is going to be Twilight anaesthesia. Can you explain that to me?
Yeah, sure. So Twilight anaesthesia is a form of sedation that we use here at the clinic that allows you to have your procedure done in a painless, very comfortable manner. It's a form of intravenous sedation, which means we give it through a small plastic tube that sits in your vein. And we do that at the start of the operation before anything painful at all is done. Right. The sedation itself is quite heavy sedation initially, because we don't want you to remember any of the local anaesthetic injections, which can sting a little bit. Okay. The sedation does continue throughout your procedure for the entirety of the operation, and I, along with my anaesthetic support staff, are with you the whole time, keeping a very close eye on everything. And because it's sedation and not a general anaesthetic, it avoids some of the possible complications of a general anaesthetic. For example, it would be quite unusual for you to feel sick after this kind of sedation. Also, because it's sedation, very, very occasionally you may be aware of some talking, but you shouldn't be aware of any pain at all. Right. And if you are, you can let us know that. But the vast majority of patients don't remember anything about the procedure and essentially sleep quite comfortably through the whole operation.
So I'm not going to be put to sleep, as they always say in anaesthetic, put to sleep, but I'll be half asleep, half awake?
You are quite heavily sedated, and most people do put to sleep, but it isn't a full general anaesthetic, that's right.
But I still won't remember that.
You may occasionally remember talking, but you won't. The vast majority of people don't remember anything at all and find it a really nice, comfortable, stress-free procedure, actually.
And how long does it take to get over it when I wake up?
It depends on the length of your operation, but typically within a few minutes after your operation is finished, we were able to take you through to the recovery room where you'll be awake, eating and drinking within 15-20 minutes or so usually.